Before starting to take Rybelsus 14 mg tablet, make sure to read the medication guide provided by your pharmacist. Take this medication with a sip of plain water as directed by your doctor, usually once daily. Do not take it with any other beverage. Swallow the tablet whole and wait at least 30 minutes before eating or drinking anything other than plain water and before taking any other medication by mouth. For the best effect, you should eat 30 to 60 minutes after taking Rybelsus 14 mg tablet. It is important to take this medication the same way with every dose. The dosage is based on your medical condition and response to treatment, and your doctor may direct you to start at a low dose and gradually increase it to reduce the risk of side effects. Remember to take it at the same time each day to get the most benefit from it. Do not increase your dose or use this drug more often or for longer than prescribed. If your condition does not improve or gets worse, make sure to inform your doctor. If you experience nausea, vomiting, abdominal pain, loss of appetite, diarrhea, or constipation while taking Rybelsus 14 mg tablet, these side effects may improve with continued use. However, if they persist or worsen, it's important to inform your doctor. Remember, your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects, but it's important to seek medical attention if you notice any signs of kidney problems or vision changes. While Rybelsus 14 mg tablet typically does not cause low blood sugar, it may occur when taken with other diabetes medications, or due to factors such as alcohol consumption, inadequate calorie intake, or intense exercise. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, and hunger, and it's important to have a plan in place to address low blood sugar episodes. Symptoms of high blood sugar include increased thirst and urination, and if you experience these symptoms, it's important to consult your doctor for potential adjustments to your medication, exercise, or diet. In the event of a severe allergic reaction, such as rash, swelling, dizziness, or difficulty breathing, seek immediate medical help. This is not an exhaustive list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you have concerns about side effects, you can also report them to the FDA in the US or to Health Canada in Canada. Before taking Rybelsus 14 mg tablet, make sure to let your doctor or pharmacist know if you have any allergies or if you are allergic to it. It's also important to discuss your medical history, especially if you have certain eye problems, pancreatitis, gallbladder disease, kidney problems, or stomach/intestinal disorders. You may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar, so it's important to be cautious when driving or using machinery. It's also important to limit alcohol intake while using this medication to avoid low blood sugar. Stress on the body, such as due to fever, infection, injury, or surgery, can make it harder to control your blood sugar, so it's important to consult your doctor if you experience any of these situations. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription and non-prescription drugs. If you are pregnant or planning to become pregnant, make sure to discuss with your doctor the benefits and risks of using this medication during pregnancy. The manufacturer recommends stopping use of this medication 2 months before a planned pregnancy. Pregnancy may cause or worsen diabetes, so it's important to discuss a plan with your doctor for managing your blood sugar while pregnant. It's also important to consult your doctor before breastfeeding if you are using this medication. It's important to be aware of potential drug interactions that could affect how Rybelsus 14 mg tablet works or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor. If you are taking beta-blocker medications, they may prevent you from feeling the fast or pounding heartbeat that usually occurs when your blood sugar falls too low. However, other symptoms of low blood sugar, such as dizziness, hunger, or sweating, are not affected by these drugs. It's also important to note that many drugs can affect your blood sugar, making it more difficult to control. Before making any changes to your medication, be sure to speak with your doctor or pharmacist about how it may affect your blood sugar levels. Be sure to check your blood sugar regularly and share the results with your doctor. If you experience symptoms of high or low blood sugar, notify your doctor right away. They may need to make adjustments to your diabetes medication, exercise program, or diet. If someone has taken too much Rybelsus and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center for assistance. It's important not to share this medication with others. If you're taking Rybelsus 14 mg tablet, you should consider attending a diabetes education program to learn more about managing your diabetes with medications, diet, exercise, and regular medical exams. It's important to also learn the symptoms of high and low blood sugar and how to treat low blood sugar. Check your blood sugar regularly as directed by your doctor. While taking this medication, you may need to have lab and/or medical tests done, such as kidney function, fasting blood glucose, and hemoglobin A1c. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose, just skip it and take the next one at the usual time. Don't take 2 doses at once to make up for the missed one. Make sure to store Rybelsus 14 mg tablet antihyperglycemic, Incretin mimetic agent at room temperature in its original container, away from light and moisture. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to disposing of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Always remember to handle medications responsibly to ensure the safety of your family and the environment. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.